So, good evening to everyone. Again, I'm Dr. JM, and our topic for this week is about the primary hemostasis. So, when we say hemostasis, it has two stages. We have the primary and the secondary in the books, but actually, we have three because in the books it states primary hemostasis, which involves the blood vessels and the platelets. For the secondary hemostasis, it talks about the coagulation cascade, and then for tertiary, actually it talks about the fibrinolysis. Okay, but for this week, our topic is about the primary hemostasis. So just an overview of hemostasis. It talks about it is a complex physiological process that maintains blood in a fluid state and forms clots when necessary. So what's the importance of hemostasis? This is crucial to avoid life-threatening conditions such as hemorrhage and thrombosis. So as you know, hemorrhage is massive bleeding and thrombosis is the formation of clots. So there needs to be a balance in the blood so that we don't form these conditions para hindi tayo mag-bleed, at the same time hindi mag-form ng clots which will lead to ischemia and leading to stroke and heart attack. So just an overview, for the components of hemostasis, we have the blood vessels, platelets, and plasma proteins. So the function for blood vessels, of course, it is for vasoconstriction. For platelets, of course, they are for adhesion and aggregation, and then for the plasma proteins, they give us the coagulation enzyme activation. So in primary hemostasis, it is the role of the blood vessel and platelets in response to a vascular injury or to the commonplace desquamation of dying or damaged endothelial cells. So basically, they just plug what it is that has a hole in the blood vessel. So processes the blood vessel contract to seal the wound or reduce the blood flow. So this is what you call vasoconstriction. For platelet activate, after that, you will have platelet activation and aggregation, leading now to the formation of your platelet plug. For us to control major bleeding in the long term, the plug or platelet plug that has been formed must be reinforced by fibrin. Ito yung kumbagang when we are constructing a house, ito yung kumbaga palitada para ma-strengthen yung na-form na platelet plug. So conditions, defects in the primary hemostasis can lead to chronic hemorrhage as seen in patients with hemophilia. So for the secondary hemostasis, our topic after midterms is just the activation of the coagulation proteins leading to fibrin clot formation, because that's the ultimate end goal, the activation of fibrinogen to fibrin. So you have your zymogens, which are in active form, and then thrombin generation leading now to fibrinogen, and the final event would now be your fibrinolysis, which will lead to the digestion and removal of the fibrin clot during healing. So in your hemostasis, initially there needs to be a damage in the blood vessel. So once there is a damage in your blood vessel, you will activate the three: your primary, secondary, and tertiary hemostasis. Your primary hemostasis, your blood vessels will constrict, and then your platelet will be activated. Your secondary hemostasis, there's activation of the clotting system. And then for your tertiary hemostasis, this is now the fibrinolytic system. Later on, we will discuss about the fibrinolytic system because it also counteracts or balance our hemostasis, because it will degrade the fibrin clot that has been formed so that you will not form or make your patient prone to thrombus formation. And then kasi diba in hemostasis, gusto mong magkaroon ng platelet plug na na-reinforce ng fibrin, at the same time, ma-degrade pa rin yun because that is only temporary. Once the healing stops, you also need to degrade or tanggalin yung linagay mong platelet plug na nandun. And that is by the help of your tertiary hemostasis, which is the fibrinolytic system. So just a comparison of your primary and secondary hemostasis. Your primary hemostasis is activated by desquamation of your blood vessels. It involves the vascular intima, and it has a rapid and short-lived response. And then usually ganyan yung reaction ng katawan ng tao if there is a rapid process, it's also short-lived. Kumbaga, mabilis umaksyon pero saglit lang. As compared to secondary hemostasis, which is delayed, matagal nga, pero pangmatagalan yung epekto. Like, guys, sa jowa mo, kung madali mo siyang nakuha, madali din siyang mawawala. Kung pinaghirapan mo siya, mas magtatagal yung relationship, diba? So, in primary hemostasis, there is a procoagulant substances which are exposed or released by damaged or activated endothelial cells. And in secondary hemostasis, it is activated by large injuries to blood vessels and surrounding tissues. It involves platelet aggregate and coagulation system, and the activator tissue factor is exposed on cell membranes. So your primary hemostasis, it check and balance. There is a check and balance mechanism of the blood. So the clot should be lysed by plasmin later on, and the series of complex processes by which the body spontaneously stops bleeding and maintaining blood vessel damage. So the components of your primary hemostasis is, diba, as I've said, is the blood vessel and the platelet. So there is a classification, okay, of the components. We have the extravascular, the vascular, and intravascular. So outside the blood vessel, inside the blood vessel, and outside the blood vessel, within the blood vessel, and inside the blood vessel. So let's go now to the let's go to them one by one later on. So for the blood vessels in hemostasis, we have the vascular response. What is the primary vascular response of our blood vessels? Of course, it's the vasoconstriction. So vasoconstriction, it initiate contact activation of platelets, and it releases tissue thromboplastin. And when there is exposure to collagen, the intrinsic pathway of hemostasis is activated. And thromboplastin is the activated extrinsic factor of hemostasis. So basically, you need the blood vessel needs, or if there is something wrong with the blood vessel, it triggers now a cascade that will ultimately activate din yung secondary hemostasis natin. So for the extravascular component of our blood of our hemostasis, so what are the things that is involved here? So we have your tissues. So they are present outside the vessel. It surrounds the vessel wall and plays a part in hemostasis by providing back pressure of the injured blood vessel through swelling and trapping of the escaped blood. So kapag nasugat ka, of course, the surrounding tissues will basically form a protective layering para hindi na ultimately kumawala yung blood. So it's important to have an intact tissue because you can see this particularly kapag nagkaka-ecchymosis or yung sinasabi yung hematoma kapag nag-phlebotomy kayo, pag nagpapasa siya. Basically, yung tissue surrounding that, they help also to stabilize or stop the bleeding. Important to have an intact tissue because in cases of injury, tissues that surrounds the vessel will help out to trap the escaped blood, and trap the blood or control the escape of the blood through process called swelling. So young individuals have more intact vessels and more intact tissue, and in adults the vessels are fragile. The tissues are used that will make longer to heal the damage they have. And excessive bleeding or hypocoagulable state or uncontrolled thrombosis, we have what you call the hypercoagulable state. So what this slide just talks about is that when you are younger, of course, you are more capable of healing or using the tissues surrounding your blood vessels to heal your wound. But if you are matanda na, you have a poorer surrounding tissue dahil nga sa loss of collagen, loss of connective tissues around the area. Therefore, you are more prone to bleeding or lower yung kakayahan mo para makapag-heal. So, the arteries and veins, we have three major layers. So, we have the tunica interna, the tunica media, and the tunica externa. So, as you can see here, this is a picture of your blood vessel. So, this is a cross-section of the artery, and the innermost part is your tunica interna, which functions to slick the surface flow. So when we talked about the shear pressure, diba, because of the contact of the blood and the blood vessel, so basically that's the function of the tunica interna. The tunica media, which promotes now the vasoconstriction and vasodilation, and the tunica externa, which functions to anchor and protect the entire blood vessel. So the tunica externa, which is also called the tunica adventitia, it's the outermost layer, and you can find more or abundant collagen on this part, because ito na yung pinaka-closest to the surrounding tissues, and your tissues is made up of most of the time collagen. So it has a connective tissue, and collagen are present and makes your blood vessels intact, flexible, and elastic. That's because of the connective tissue surrounding the tunica adventitia, because the tissue surrounding your tunica adventitia has a lot of elastin, collagen. That's why your tunica adventitia is flexible and elastic. After that, we have your tunica media. It's the middle layer. The tunica media contains lesser collagen, but it has a more abundant smooth muscle cells. When these smooth muscle cells are present in the tunica media, it gives now the blood vessel its ability to vasoconstrict or vasodilate. Dito na pupunta yung mga ADP or serotonin, dito nag-act sa smooth muscle cells on the tunica media para mag-constrict or mag-vasodilate yung ating blood vessel. It also contains your collagen fibers and fibrinoblast, but relatively comparing it to the tunica adventitia, it has a lower component, more on smooth muscle talaga siya. And the tunica intima, which is the innermost layer. So this layer, it is where endothelial cells and subendothelial cells are formed. It separates formed elements such as platelets from adhering on subendothelium, and it separates or gives the barrier from platelets to the subendothelium containing collagen. And the endothelium cells are found. So it's basically the innermost layer that sticks to the blood or has contact to the blood. But later on, we will discuss yung mga substances secreted by the tunica intima, which does not promote the adherence of platelet to the surface para hindi ka basta-basta nagkakaroon ng clot pa rin. So the vascular intima, it's the innermost layer of the blood vessel consisting of endothelial cells. So its role in hemostasis, it acts as a key interface between circulating blood and body tissues, and playing a critical role in maintaining blood fluidity and promoting clot formation when necessary. So take note of the word when necessary lang. Hindi basta-basta nagkakaroon ng clotting dyan. So the structure of the vascular intima, so we have the endothelial cells. So dito tayo more on magfo-focus sa tunica intima, because we will learn later yung mga substances that are secreted by this layer, so that we can have a procoagulant or an anticoagulant state. So the endothelial cells, they are metabolically active and heterogeneous. It has a unique characteristic based on environment and function, and it has supporting layers such as your internal elastic lamina or the basement membrane, and has connective tissue with fibroblasts producing collagen. It also the presence of smooth muscle cells in arteries and arterioles. So the anticoagulant properties of your intact vascular intima, you have your smooth surface. So the endothelial cells provide a smooth surface that prevents harmful turbulence and platelet activation. As we have learned in the previous lectures, diba, we have a constant shear stress na nandyan sa blood vessel natin. So the smooth surface as provided by the tunica intima, it prevents now turbulence para para easy lang kumbaga yung pag-flow ng blood na nandyan. Kasi once na may disruption of the flow of blood, like in the presence of thrombus or yung mga taba na naiipon by your LDL or in atherosclerosis, nagkakaroon ng turbulence which now initiates your clotting system or coagulation cascade. So it also acts as a physical barrier which separates the procoagulant proteins and platelets from collagen and tissue factor in the underlying layers. As you can recall, di ba? Surrounding the blood vessel is your connective tissue. And basically in the tunica adventitia, connective tissue na yun eh. Ano yung meron sa connective tissue na yun? Yun, di ba? Yung collagen. And we have learned previously na kapag na-expose yung platelet sa collagen, it can also be activated. Kaya, this vascular intima, it serves as a barrier para hindi magkaroon ng contact si platelet tsaka yung collagen na nasa connective tissue para hindi siya ma-activate. Kasi saka lang siya ma-expose sa collagen kapag meron niyang damage doon sa blood vessel or kapag na-damage mo tong tunica intima. So the key anticoagulants produced by your endothelial cells are, number one, we will go to them one by one, but this is just a rundown. So we have your prostacyclin, which came from what pathway? Diba? As I've discussed before, in the eicosanoid pathway, which prevents or promotes platelet activation. It prevents platelet activation or it inhibits platelet activation and acts as a vasodilator. So you also have your nitric oxide. It promotes vasodilation and inhibits platelet activation and supports angiogenesis. Angiogenesis means the formation of new blood vessels. So the tissue factor pathway inhibitor, your tissue factor kasi is your factor 7. Factor 7. So, you need to inhibit this by your tissue factor pathway inhibitor so that it regulates the extrinsic coagulation pathway. And then you also have your thrombomodulin and heparan sulfate, which inhibits thrombin formation through the protein C pathway and enhance antithrombin activity. So, this is just a diagrammatic representation of the hemostatic properties of the endothelial cells that line the inner surface of your blood vessel. So, as you can see there, the ones that are on top, like your smooth endothelial cell lining, your prostacyclin or PGI2, nitrous oxide, heparan sulfate, tissue factor protein inhibitor, your thrombomodulin, your EPCR, and your endothelial cell protein C receptor, and then your TPA or your tissue plasminogen activator. These are all anticoagulant, okay? And then tong mga nasa baba naman, they can be procoagulant. Itong vasoconstriction, von Willebrand, Adams 13, P-selectin, collagen, 'di ba? So this one, yung mga nasa baba, these are your procoagulant substances. As compared sa mga nasa taas, these are anticoagulant substances. And this one, you have your anticoagulant properties of the intact vascular endothelium. You can have your, ayan nga, as I've said, meron tayong prostacyclin, nitric oxide, and then yung anticoagulant property nila. So, one thing to note here is your nitric oxide, it's also called as your relaxing factor. That's why we have yung mga gamot na that basically contains nitric oxide, your isosorbide mononitrate, isosorbide dinitrate. Ginagawa nila yon, binibigay natin yon sa mga pasyente nating may mga chest pain or sinasabi nating angina. So when you take them or kapag pinapainom mo sila ng nitrate or nitrous oxide, nagkakaroon ng vasodilation. That's why lumuluwag yung coronary arteries nila, kaya nawawala yung chest pain and nawawala yung congestion. Saan pa? Kung familiar kayo sa what's this? wag na nga. Pero may recreational drug kasi that's called amyl nitrite, or yung by street name tinatawag siyang poppers, or yung poppers na yun is ginagamit siya during sexual, para siyang aphrodisiac, hindi na aphrodisiac eh. Ginagamit siya pang pataas ng libido in a way, because that amyl nitrite is a form of nitric oxide na kapag sininghot mo siya, nagkakaroon ng vasodilation, particularly doon sa blood vessel nung ari nung lalaki, therefore giving you a more powerful or more stronger erection, ganon. So ganon yung epekto ng nitric oxide. What else? So you also have your protein C coagulation control system activator in the form of your cell membrane thrombomodulin. So basically lahat ng to, they are all anticoagulant. It prevents clotting, okay? Ito yung mga natural substances na nasa endothelial cell natin para hindi magkaroon ng clot. So in order for us to form a clot later on, you need to inhibit tong mga to, okay? Sige. So let's go to them one by one. So factors or substances contributing to thromboresistance. So you have your heparan sulfate. So it's a naturally occurring anticoagulant. So as associated with heparin as anticoagulant, heparin inhibits thrombin. Thrombin is our factor 2, di ba? So factor 2 kasi, it will activate factor 1, which is fibrinogen. So kapag nawala si heparin, ma-activate niya yung si thrombin, di ba? So need mo ng heparin para hindi ma-activate si thrombin, para hindi ma-activate si factor 1. Cascade siya. So it will amplify the activity of antithrombin 3 and increase its activity 3,000 times. So your antithrombin 3 also inhibits your thrombin, and if present, it means more thrombin is inhibited. So thrombin is important for the conversion of fibrinogen to become a fibrin, or yung tinatawag na nating clot. So fibrinogen to fibrin. So basically ito yung mechanism niya. So this one, heparin, it will further amplify the effect of antithrombin 3. So, yung antithrombin 3, it will inhibit the conversion of your fibrinogen to fibrin. That's why kapag meron tong dalawang to, wala kang fibrin na mafo-form. So, it will just stay as a fibrinogen, which is a zymogen. Inactivated siya. Zymogen. Inactivated lang to. So, kapag nawala yan, si heparin and thrombin, of course, there is pursuance of this pathway. So magkakaroon ka ngayon ng fibrin kasi nga walang nang inhibit kay thrombin. And then you also have thrombomodulin. So it counteracts thrombin by absorbing thrombin. So it has two functions. It absorbs thrombin. So this thrombomodulin, kinukuha niya si thrombin. So wala ulit mag-activate kay fibrinogen towards becoming a fibrin. So it also activates a vitamin K dependent protein called protein C. Ano ba si protein C? Protein C and protein S, once present, it inactivates clotting factor 5 and 8. Okay? So, ayun, later on mamimit pa natin si protein C and S when it comes to the coagulation cascade, but as early as now, you must know that protein C and protein S, they inactivate clotting factor 5 and 8. So, kapag na-inactivate yan, wala ulit fibrin na mafo-form. And again, your nitric oxide, it prevents platelet aggregation, stimulation, and activation. But basically, yung pinaka-function talaga ni nitric oxide is vasodilation. Another one is your cluster differentiation 39 or CD39. Yung ginagawa naman nito is that it converts ADP to AMP. Diba, as we have learned before, ATP is the one that has energy, diba? So ADP, diba, yung ADP is a dense granule, di ba? And ADP activates now your platelet. So, kapag na-convert si ADP, kapag na-touch niya si platelet, na-activate ngayon si platelet, di ba? Pero kung AMP yung meron, walang platelet activation na mangyayari. That's why your CD39, it acts to convert ADP to AMP. So, ADP aggregates the platelets, allow the platelet to form a clot. and can be present in other parts or tissues in the blood, binds them together. So AMP, in the presence of AMP, platelets will not aggregate. That's why, as you can see here on the picture, here, ATP or ADP, in the presence of CD39, it will be converted now to AMP. And as I've said before, di ba, kapag meron kang mataas na CAMP, di ba, ano mangyayari? There will be no platelet activation. Okay. So, wag kakalimutan yung mga tinuro ko, ha? And of course, you have your prostacyclin or prostaglandin I2 or PGI2. So it is derived from a phospholipid layer of the endothelial cells by your enzyme, your phospholipase A, di ba? Phospholipase A, arachidonic acid, and then two pathways, your lipooxygenase and your cyclooxygenase. By your cyclooxygenase, mafo-form si thromboxane, prostacyclin, and prostaglandins. So your endothelial cell contains phospholipid on its layer or its membrane, and the phospholipid releases out arachidonic acid, which will undergo a pathway called cyclooxygenase. So your prostacyclin is a vasodilator, and it prevents platelet aggregation. Another one is your 13-HODE or HODE, which stands for 13-hydroxyoctadecadienoic acid. Napakahaba, 13-HODE na lang for short. Or 13-HODE, para mas brainy na pakinggan. Hindi EDTA, like EDTA. So it prevents platelet adhesion, and it's derived from linoleic acid of the blood vessels. The linoleic acid na sinasabi natin dyan is a form of fats. And galing din to sa, sino ba yung structure sa cells na may mga fats? Cholesterol, phospholipids, sa cell membrane din. Okay? So galing din si 13-HODE sa plasma membrane ng endothelial cells. So it's derived from linoleic acid of blood vessels. It prevents platelet adhesion on the damaged blood vessel wall. It pushes away the platelets if the platelet attach even without injury. So ito yung main reason bakit hindi dumidikit ng basta-basta si platelet doon sa blood vessel, not unless kung merong damage. So vessels without injury should never promote. So those are your anticoagulant properties of your blood vessels. Now let's go to the procoagulant properties of your damaged vascular intima. So let's assume na meron na tayong na-damage or nagkaroon ng breakage doon sa blood vessel natin. So anong mangyayari? So there is vasoconstriction. So smooth muscle contraction reduces blood flow at the injury site, and there is exposure of the subendothelial tissues. And as you know, the subendothelial tissues contains now your collagen, which binds and activates your platelets. It also contains your von Willebrand factor, and it is secreted by your endothelial cells to facilitate platelet adhesion. So adhesion molecules in your platelets includes now your p-selectins, your ICAMs, PECAMs, diba, as we've learned in the previous topic. So they promote platelet and leukocyte binding. So the tissue factor exposure, it activates the coagulation system through interaction with plasma factor 7. So in your extrinsic pathway, basically, that's tissue factor all in all. So factor 7 is activated, and then after activation of factor 7, it will activate now fibrinogen, and then activation of fibrinogen leading now to your fibrin formation. So this is your procoagulant properties. We have now your smooth muscle cells in the arterioles and arteries. So they induce vasoconstriction. Remember that in the tunica media, a majority of it is composed of smooth muscle cells. So smooth muscle cells, it's a muscle, so it can control the area of your blood vessel via vasoconstriction or vasodilation. So the exposure of the subendothelial collagen, so basically kapag there's exposure, it binds now von Willebrand factor and activates your platelets. So activated endothelial cells also secrete von Willebrand factor, which is important for platelet binding to collagen and platelet adhesion as a first line of defense against bleeding. So you have your P-selectins, ICAMs, PECAMs. So they promote platelet aggregation and leukocyte binding. You also have your endothelial cells in inflammation because your tissue factor is induced by inflammation. After that, of course, we have the anticoagulant properties and then your procoagulant properties. We also now have your fibrinolysis support. So the endothelial cells also secrete tissue plasminogen activator to initiate breakdown of fibrin clots. Because after the formation of your fibrin clots, it needs to be lysed. It needs to be removed. Okay? Parang kumbaga yung na lagay natin na clot doon to stop the bleeding, we still need to remove that para maganda yung flow ng blood, para hindi magkaroon ng turbulence. Kasi kung yung blood vessel mo ganyan, tapos may nakabara doon na clot, of course, that promotes still thrombosis, di ba? So that needs to be removed. So your tissue plasminogen activator, it activates fibrinolysis by converting plasminogen to plasmin, which gradually digests your fibrin and restore now your blood flow. So the regulation of fibrinolysis, it is regulated by your plasminogen activator 1, plasminogen activator inhibitor 1, which inhibits excessive plasmin generation, and your thrombin activated fibrinolysis inhibitor, which further regulates fibrinolysis by inhibiting plasmin generation. Because your plasmin comes from plasminogen, okay? So, need ma-activate ni plasminogen into plasmin. Kapag activated na si plasmin, it will now, so wait lang. So, plasminogen and then plasmin, di ba? So, in order for plasmin to be activated, kailangan mo ng tissue plasminogen activator, yung color violet or color pink na nandyan, okay? Anong gagawin ni plasmin? Plasmin will lyse or degrade now your fibrin, okay? So once na na-degrade si fibrin, you will have now your clot lysis, okay? And then, to regulate fibrinolysis, hindi naman kasi pwedeng na-activate every time si fibrinolytic system natin, or else walang mafo-form na clot, di ba? So for the regulation of fibrinolysis, we have your plasminogen activator inhibitor. From the name itself, ini-inhibit niya si plasminogen, and then your thrombin activatable fibrinolysis inhibitor further regulates fibrinolysis by inhibiting plasmin generation para yung nafo-form na clot na nandun, nagsistay siya for a short period of time only. Okay? It will be lysed later on. Okay? And then, so that's it for your blood vessels. Again, your primary hemostasis is made up of your blood vessel and your platelets, diba? So that's all about your blood vessels. Now let's go to your other component, which is your platelets. So this is now intravascularly, because we have talked about extravascularly, the surrounding tissues, the vascular or the blood vessel itself, and then intravascularly. Let's now go to your platelets. So as we have learned, platelets are small metabolically active blood cells derived from megakaryocytes in the bone marrow. Its size, it's typically 2 to 3 micrometers in diameter on a peripheral blood film. It is essential for initiating and controlling hemostasis. The origin of it, we have learned about it in megakaryocytopoiesis and thrombopoiesis. And for its maturation, it's released into the bloodstream as a small aneuploid cell fragments. So platelets in hemostasis, we have the steps in platelet plug formation. So of course, there needs to be a damage in the blood vessel wall. And after damage, there's exposure of collagen, fibronectin, and basement membrane of the blood vessel. Now you have your adhesion, and then of course, the platelet will be activated. So that is manifested by your shape change. And then after activation, you will now have your aggregation. And then after aggregation, there's a release reaction by which yung mga granules are released in order to further activate other platelets and to further activate the coagulation cascade. And then once na-activate sa coagulation cascade, meron ka na ngayon platelet plug stabilization. So key function of your platelet is adhesion. It's the binding of non-platelet surfaces such as your subendothelial collagen, and your aggregation, which platelets bind to one another forming a platelet plug, and secretion, which release of granule of contents that promotes coagulation and vascular repair. So this is just a summary of your platelet function. We have adhesion, platelets roll or cling to non-platelet surfaces. It's reversible. For aggregation, it's irreversible, in which platelets adhere to one another. And after that is secretion. Platelets discharge the contents of their granules, may it be alpha or your dense granules. It's also irreversible. So in platelet adhesion, platelets adhere to exposed collagen at injury sites. So there is the role of your von Willebrand, which binds now to your GP1B, di ba? Sabi ko noon, GP1B or GP1A actually. GP1B or GP1A, that is for your platelet adhesion. It will adhere to your von Willebrand, and then von Willebrand will adhere to your collagen. So the clinical relevance of this, there are persons that have a syndrome which is called the Bernard-Soulier syndrome and von Willebrand disease. So later on we will discuss these diseases in the diseases of primary hemostasis. Just remember that Bernard-Soulier syndrome and von Willebrand disease is mainly concerned with platelet adhesion. Okay? So, after that, we have your platelet aggregation. Aggregation naman is 2B3A, di ba? Platelet aggregation, activation of your 2B3A receptors allows binding of fibrinogen, linking platelets together. So, platelet, GP1B, 2B3A, fibrinogen, and then platelet. So, yan siya. So the role of fibrinogen, it's essential for platelet aggregation, and defects leads to conditions like Glanzmann thrombasthenia. So commonly used in vitro stud agonists include your thrombin, ADP, collagen, and epinephrine, because these molecules are well known to activate platelets. So platelet activation leading to platelet aggregation. So you need ADP, thrombin, collagen, epinephrine to aggregate now your platelets. So one thing to highlight here in this slide is the Glanzmann thrombasthenia, because later on, again in the diseases, we will talk about this disease. Again, just a recap, when we say platelet adhesion, diseases concerning there is your Bernard-Soulier and von Willebrand disease. When we talk about platelet aggregation defect, we talk about the Glanzmann thrombasthenia. So in platelet secretion, you have your alpha and your dense, diba? So on the picture or in the table, you have your alpha and your dense granules. It's just a review. So tapos na natin to, diba? So we have your CAMAS or your calcium, ATP, ADP, magnesium, and your serotonin. So the granule contents, you have your platelet release procoagulants and controlled proteins. So there's secretion timing. Most secretion occurs late in the platelet activation process, and their role in hemostasis is that they are released substances amplify the coagulation cascade and promote wound healing. So another role of your platelet is your production of thromboxane, di ba? Thromboxane is the kabaliktaran of prostacyclin. So thromboxane is derived from your arachidonic acid or your eicosanoid pathway. So arachidonic acid is converted to thromboxane, promoting now platelet aggregation and vasoconstriction. So the role of aspirin here, as I've said before, yung mga NSAIDs natin, is that it blocks now your thromboxane production, impairing platelet function. That's why, again, as I've said, kapag may yung patient natin nagtitake ng aspirin, they are temporarily deferred for 3 to 5 days. Because the intake of aspirin will block the formation of thromboxane. So basically, your platelets cannot be activated. Hindi mo siya, yung blood na idodonate niya, hindi pwedeng magamit for platelet platelet concentrate. At the same time, mas prone siya to bleeding kasi nga medyo malaki yung needle that is needed for phlebotomy in blood donation. So platelets we also have the surface role. Platelets provide the membrane phospholipid phosphatidylserine necessary for forming coagulation complexes as well as the coagulation cascade. The coagulation cascade, the platelets participate in the formation of extrinsic and intrinsic tenase complexes, leading to thrombin generation. The tenase complex there is just an enzyme, which we will meet later on when we talk about the coagulation cascade. So, your platelets also interact with other cells. They interact with erythrocytes or your RBCs, which contributes to the clot bulk and structural integrity. As I've said, diba, before, yung patong-patong na kapag nagkakaroon na ng clot, hindi na lang platelets yung nandun. Nandun na rin yung red blood cells, the white blood cells, and all. So you also have your leukocytes, which participates in hemostasis through surface-borne tissue factor and inflammatory cytokine production because your WBCs release inflammatory mediators like your interleukins, diba? And your interleukins will further promote inflammation, and promotion of inflammation will attract more platelets on the site of the wound. You also have your monocytes and lymphocytes, which provide additional support in wound healing and immune response. So the platelet release reaction, your platelet factor 3, it's a lipoprotein or phospholipid found in the platelet granule and membrane, and it plays an important role in the activation of the coagulation mechanism, and later on will promote the stabilization of your plug or your platelet plug. And then for the platelet plug stabilization, your platelet factor 3 helps in the thrombin formation through the activation of the clotting factors in the extrinsic, intrinsic, and common pathway. So it participates in the prothrombinase complex, just like the tenase na sinasabi ko kanina. Mamimit natin to sa coagulation cascade. Platelet factor 3 acts with certain plasma thromboplastin factors to convert prothrombin to thrombin, or your factor 2. So that's all for, I think that's all for your primary hemostasis. So next week, or our next topic, will be diseases regarding primary hemostasis. So we will have platelet diseases. So we can have quantitative and qualitative platelet disorders. When we say quantitative, thrombocytosis and thrombopenia. When we say qualitative, the inability of platelets to be activated. And then, or nagpo-produce ka nga ng platelet, hindi naman okay si platelet mo, di ba? And then we also have your blood vessel defects. So, dyan yung mamimit si von Willebrand disease, tsaka Bernard-Soulier, mga ganun. Okay, so that would be all, and wishing you a Merry Christmas. And to be honest, I am really having fun teaching at National University. So it's good then I'm meeting new students this year. Pinapalawak ko yung kumbaga network ko, because in the future we will all be my colleagues, and I hope you will remember me. Nagdrama. But yun, Merry Christmas to one and all, and meeting all of you is a gift to me. So that's all.